Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health and Master of Arts in Environmental and Occupational Health. Welcome to this session. Today we will discuss on the course MEV 005, that is Occupational Health and Safety, which forms a part of your program. And to discuss on this we have the topic as lead poisoning. And we have with us in the studio Dr. Saswati Das, who is the Assistant Professor from the Department of Biochemistry from Atal Bihari Vajpayee Institute of Medical Sciences, and Dr. Ram Manohar Lohia Hospital in New Delhi. Welcome to this session, ma'am.
Thank you.
So, when we talk about lead, so lead may be present to some extent in our air and also in the soil in which we grow our crops, and also in the old pipes where we also get our water from. So lead is there even in the intercity environments, in the urban environments, and long ago it is seen that lead is quite toxic. And even now there are reports saying that the lead could be toxic for the human beings, especially for the children where they are showing some kind of aggressive behavior. So long ago in the Roman Empire, it has been observed by scientists that the Romans were using tremendous, that is they produced and also they used tremendous amounts of lead in the manufacturing of their pots in which they used to make the wine. Some kind of the grapes were crushed and then they were made into a syrup and then the wine was formed. And maybe the taste was given by the same lead content. In the same way, they also made their pipes and some paints and so on. So lead was really used a lot by the Romans. And in the Greenland glaciers, some of the geologists and the scientists, they studied the ice cores, and then it was found that from the ice cores that between 500 BC and 300 AD that the lead content was found to be 4 times more than the norm in the ancient Romans. And also the bones of these ancient Romans also were discovered, and that was also analyzed for the same. So it has been observed that this lead definitely caused a toxicity, and the ice cores of the Greenland, how the glaciers got them, this may be because of this smelting and the mining of these lead containing ores, and that has contributed to the lead in the atmosphere, which then settled onto the glaciers. So therefore lead has impacted our environment and it has impacted the health of many of the people living here. So it is very much important for us to understand the toxicity, the toxic actions, and on what all organs this toxicity is exerted. So Dr. Saswati, the first question that I would like you to explain to our learners is that from where do we get the lead? Where are the sources of the lead into maybe the food sources and so on? And also if you could shed light on the permissible limits of the lead in the food and the food containing products.
Thank you, Dr. Sushmitha. Good afternoon, learners. So, as Dr. Sushmitha was describing, there are various sources of lead in the environment. One of the major sources in our part of the world is coming from the food. Then it comes from the lead-based paints that we have. It is there in the soil content. Previously, there used to be a form of petroleum that we used, which was known as gasoline. So, it had a very high lead content. So, that is to lead to a lot of poisoning. There are certain industries which produce lead, like the automobile industry, the battery recycling and manufacturing industry. So these are some of the major occupational exposure of lead. And as Dr. Sushmitha was asking me, what are the permissible limits of lead? So for in the food content, for children specifically, as they are the most vulnerable population for lead poisoning, the amount that is recommended is 2.2 microgram per day. And for pregnant women, it is 8.8 microgram per day. Pregnant women, it's very important to measure the lead content in them because there is a developing fetus which is growing in the mother, and lead is something which causes to the placental barrier, and it may cause developmental delays in the fetus. So I will start with my lecture today. So the learning objectives for all of you learners is to define what is lead poisoning, What are the sources of lead? How do you identify? How do you recognize the symptoms of and the health effects of lead? What are the vulnerable populations? What are the signs and symptoms? How do you describe the prevention strategies and discuss the treatment and intervention? So what is lead poisoning? Lead, as you know, is a heavy metal. Lead is soft, malleable, ductile, and it has less corrosive properties. That is why it is used extensively. So lead poisoning, it occurs when lead accumulates in the body. When does this happen? Due to the exposure to lead-based products in an environment which has a high lead content. What are the sources of lead? So as I was telling you earlier, the major sources of lead are dust, paint, soil, food products, and then some are present in the home remedies that are used, the traditional medicines that are used, cosmetics that are used. There is something known as endogenous exposure. What is endogenous exposure? It is when somebody accumulates lead for a long period of time. It is stored in the tissues. So there it leads to a chronic symptoms of lead poisoning. Then drinking water contaminated by lead pipes is one of the major causes of lead toxicity. So how do we get exposed to the lead? We can swallow lead dust. There is a process known as sanding. So when you remove lead-based paints from the walls, you can get exposed to the lead dust. You can inhale the contaminated air which is contaminated with the lead dust. Then you can have jewelry, cosmetic products which contain lead. There can be paint chips that you can inhale while removing a lead-based paint. Then the children are at the highest risk of inhalation of lead-based paint, and pregnant women with a developing fetus is highest at the risk of exposure, as she can pass on the lead to the fetus that is growing within her. So we can now discuss the health effects of lead. Lead is a metal which can deposit in all the systems of the body. So some of the major effects of lead are anemia, kidney damage, developmental issues in children, irritability, cognitive defects, IQ degradation in children. What are the long-term exposures? Causes: cognitive and behavioral problems. So lead in drinking water, it was a major problem, and United States has been battling with this problem for a very long period, and they have brought regulations to control the lead in the drinking water. So where is this lead coming from? It can come from the lead containing pipes, the brass faucets, the fixtures, the plumbing material that is used. There is a major problem with lead is that we also tend to boil the water to get rid of any pollutants or microbial content in the water, but boiling does not get rid of the lead. So what can get rid of the lead is running cold water before use. So that helps in a little bit of reduction of the lead. Then, as I was telling you, lead is used a lot in food products. So the minimum permissible limit for children is 2.2 microgram per day, and for adults it is less than 10 microgram per day, and for women, pregnant women, it is 8.8 microgram per day. So where is this lead present in the food? So it is in the packaging, in the storage of the food, and the production lead is used. And there is a very distinct quality in lead that in certain products it will make it sweeter. As I was telling you, one of the major causes of lead toxicity is the lead in paint. It is most commonly used. Lead-based paints have been used historically in a lot of buildings, and when there is a repair work going on, there is always paint removal. When this paint removal happens, this lead can be disseminated into the air as lead particles, and we can ingest it. So it becomes very dangerous for the people who are working in the paint removal, and also if nearby there are any vulnerable population like children or pregnant mothers. So it is absolutely essential to safely remove and encapsulate the lead paint.
So just when you're talking about the lead which is present in the food products, so how do we actually know that there is lead in the food? So now you said that when you test for a product, only then you know, but how can a person be aware that, for example, I think there was something related to noodles all over globally, which had a higher lead content, and that made the noodle content also sweeter. So for a common man, for a commoner, how are we supposed to know that we are supposed to avoid these foods, or that these products contain lead, or So are there is there any mechanism for us to know about the content of lead in the food?
Yeah, so FSSAI gives a norm for lead content in the food. So all the food products that are FSSAI certified have to follow those norms. And ideally, any content of any substance present has to be written in the ingredient list that is there at the back. Because normally by consuming it, you wouldn't be knowing. But that if you follow if it is FSSAI certified in India, you will know the contents, and from the contents you will come to know, and it has to be within the permissible limits, because there is lead present all over in the environment. So there is a lead content everyone is consuming, but it has to be within the permissible limits.
Thank you.
So continuing, so as we were talking, lead is everywhere in the environment. It is in the soil because it could have been contaminated with the industry that was there working in that region, and then after its closure, that content goes into the soil. As I was telling you, battery recycling, battery manufacture, automobiles use a lot of lead content, and lead smelting also gives a lot of lead content into the soil. So there are many small businesses like cosmetic businesses, then jewelry businesses that can also lead to increase in the lead content, and the disposal of their waste can lead to the increase in the lead content in the soil. So how do we get lead in our body? There are mainly three major mechanisms. One is ingestion, one is absorption, and one is inhalation. So what is ingestion? Ingestion, what we are ingesting, that is mainly our food products that is there in the environment, or any lead containing food that we are having. Absorption, how we are absorbing from the environment, we are absorbing, like if you wear a jewelry which is a high lead content, or if you use cosmetics which have high lead content, then you can absorb it through your skin. Inhale, because of the lead dust that you can inhale that is present in the environment, or if you are occupationally exposed, if you are in an industry that you are exposed in. So where does this is how we are accumulating the lead, but where does it get deposited? It gets deposited in our tissues. As I was telling you, it affects all the systems of the body. So there is a excretion mechanism in the body which will excrete the lead, but it is not, if it is, the intake is at a very high level, it cannot excrete all the lead. So then it will affect the systems in our body. So majorly it affects the reproductive system, leading to infertility. Specifically it is seen in males. Then it can affect our respiratory system. The neurological effects are profound, especially in children. There is irritability, there is decrease in the IQ, there is cognitive and behavioral defects in the children. There are birth defects in mothers who are exposed to lead. It can also lead, some cases it can also lead to cancer. Then it can also lead to endocrine system anomalies. It can lead to a decrease in the immune functions of the body. So most lead, as I told you, is excreted, and it is exchanged between the blood and the soft tissues and the other tissues of the body, and it gets deposited over time. So in young children, the absorption capacity is 4 to 5 times more than the adults. So they have been classified as the most vulnerable population for lead poisoning. Hence, it is extremely important that educators, schools that are involved in and are dealing with children become educated about this presence of lead in our environment. In adults, some of the major effects are seen in the cardiovascular system. It can increase the risk of hypertension. It can increase the risk of ischemic heart disease leading to MIs and also stroke. In pregnant women, it is very important because it can cross the placental barrier and lead to developmental delays in the child. There is no known threshold of lead. With lead, we can never say this much exposure is okay. So you might get exposed to lead for all your life, and then at the later in your life you can have the chronic effects of lead toxicity. So you cannot say this much is okay, this much exposure is okay. But how it is monitored is we can check the blood lead levels periodically to see how much is your exposure and how much is your blood lead value, so that if you are reaching that threshold, you can be removed from that environment and the lead exposure can be decreased. The developmental delays seen in children are some of the major concerns, and this is why it was flagged in children and as a major health risk. So, neurological effects of lead. On low exposure, there is attention deficits, impaired hearing, commonly seen in children who are exposed to lead. In children, the levels are at 10 microgram per deciliter. A lot of the effects are already visible. In high exposure, the children have convulsions, coma, death in some cases. Similar effects are seen in adults, but at a higher level. What are the renal effects of lead? So in the renal system, it causes nephropathy. So it is a disease which is a form of chronic interstitial nephritis, which affects the tubules of the renal system. So it causes something called Fanconi syndrome, in which phosphates are excreted in the urine, amino aciduria is there, amino acids are excreted in the urine, and there is glycosuria, in which glucose is also excreted in the urine. So these are some of the effects that are seen. Childhood exposure can lead to the chronic renal nephritis at a later stage in life, because this gets accumulated in the renal tissue. In the blood, it's very, very important, because anemia is a very common symptom of lead poisoning, because lead is involved in the hemoglobin pathway. So the threshold for adults is 50 microgram per deciliter, and in children it can even be seen in 40 microgram per deciliter. There are two enzymes, aldehyde and ferrochelatase, that lead inhibits. So it leads to anemia. So this is an extremely important sign and symptom that we study in medicine to check for lead toxicity. As I was telling you, cardiovascular effects of lead are profound. Some of the most common are increased risk of hypertension, and this increased risk of hypertension also affects the renal system, because increased blood pressure affects the renal system as well. And also it can lead to coronary artery disease and also stroke in patients who are chronically exposed to lead. Then again, lead can cross the placental barrier. It affects the fetal viability. There are reports that there have been stillbirths in women having exposed to lead. There is child's neurological development is delayed. Sometimes the cause also cannot be identified in such children. So it may be underreported as well, the cognitive impairments happening in children due to lead poisoning.
So, Dr. Saswati, thank you for enriching our learners on this topic of lead toxicity and lead poisoning. So another thing is that we find lead everywhere in our environment. It could, as I said earlier, it is there in the air, in the urban environments, in the soil in which we grow our food, and also the lead paints. They have not been completely phased out. And of course, the lead in the gasoline, this has been taken out and phased out in many of the countries, and this is not being sold anymore. But again, we need to take more stringent action, and laws need to be enforced. And as you say, there is a lot of a problem that is seen among the children, that they have this attention deficit syndrome and aggressive behavior which is noticed, and that may be due to the foods that are containing higher content, or I would say more than the permissible limit or the prescribed limit, which may contain these harmful toxic metals and toxicants, and then that can bring about certain delayed response, for learning, and also in the case of the women who are exposed to, and even the cosmetics like the lipsticks also contain high content of lead, so that can also be one of the causes for these problems, because when we sip our coffee or the tea, and then if it is a lead containing paint which is applied to the lips, and that also could be getting into the bloodstream, and then lead can be also accumulated in the various organs and the bones of the body. So I thank you very much for this wonderful lecture, and I thank our participants and the learners of this program for your patient listening. Thank you.
Thank you.
Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health and Master of Arts in Environmental and Occupational Health. Welcome to this session. So in this session, we would be discussing about the lead poisoning, part 2. This forms a part of the course MEV 005, that is Occupational Health and Safety. And to discuss this, we have an expert with us, Dr. Saswati Das, Assistant Professor from the Department of Biochemistry, Atal Bihari Vajpayee Institute of Medical Sciences, and also a Senior Specialist at Dr. Ram Manohar Lohia Hospital. Welcome to this session, ma'am. So in the first session, we discussed about the sources of lead and the from where we can actually be exposed to the lead toxicity, and also certain symptoms of lead toxicity which is observed among the people, among the human beings, and also the children are most vulnerable to this. So now, as of now, especially now if we see the lead based gasoline products, this has been completely, it is not being sold in the markets, and as of March 2023, almost 48% of the countries have the legally binding agreements for the lead-free paints and so on, but still the lead-based paints are causing a cause of concern, and that is why the World Health Organization, along with the UNEP, United Nations Environmental Program, have joined, and they have come up with the Global Alliance, and this is basically to encourage all the countries to adopt more stringent and legally binding laws and the policies for stopping the use of the lead in these paints, because off-gassing and from this paint, when the lead is being inhaled even in the indoor environment, then that causes a lot of issues. Another problem in the developing and also in the underdeveloped countries is the lead acid batteries which are being used. So the lead acid batteries, which is an informal recycling sector, and that is sometimes not recognized by the government, then here again the lead waste can, when it is not being done, the acid batteries containing lead, when they are not being recycled in the scientific manner, in the proper scientific technique which is not used, then that can cause a lot of contamination with lead into the soil and our environment. So therefore, we have come up with a lot of laws in 2001, and also in 2022 we have this battery waste laws which came, and after this, now we are finding that all the countries are trying to abide by these rules and policies, and we should see a certain amount of decline in these noxious and toxicants which are there in our environment and which are polluting and affecting the health of many. So, continuing with this discussion, I would ask Dr. Saswati about the toxicity assessments, the toxicity tests that are being conducted for the lead poisoning among the children, among the adults, and also the various types of screening, and how is also lead being detected in the soil, and what are those factors. So, if you could put light on these, I think it would be very useful for our learners.
Yeah, so continuing from our previous session, the screening for children is very important. Ideally, as per CTC norms, children are to be screened at 1 year of age and 2 years of age in areas which have which are marked for high lead content in the environment. So if when they're screened at 1 year of age and 2 year of age, if the lead levels are found to be higher in those children, or even in the high risk area, so they are to be screened regularly, routinely. And even in mothers who are pregnant, lead testing is to be done. Blood lead levels are to be done routinely in mothers. So this is very, very important. For adults who are occupationally exposed to lead, like Dr. Sushmitha was saying about lead battery recycling. So these units which handle this lead batteries, and the units which are in which are automobile industries and jewelry industries, cosmetic industries. So the workers in these industries, they are high risk. So the policy should be to identify the high risk population and screen the high risk population. So I will continue. I'll start with my next session. So we will focus mostly on how to screen for lead poisoning, how to identify lead poisoning, what are the signs and symptoms of lead poisoning, and what are the health effects of lead poisoning, and what are the treatments that are available, and how can we make policy changes which can help identify the lead toxicity in our environment. So, how do you clinically evaluate lead poisoning? So there can be preventive screening. We can take a exposure history. So how do we take an exposure history? We will give some survey questionnaires to the high risk population, specifically the ones who are occupationally handling lead. So in the lead smelting industry, or the jewelry industry, or battery recycling industry, we will identify those workers, and we will routinely screen them with the lead survey questions. So this can be one of the easiest techniques to identify people who are at high risk. Then we can do a physical examination of the patient if they exhibit certain signs and symptoms which are seen at the low toxicity levels. Then we can have a safety officer in each of the industrial units, and if any of the signs and symptoms are exhibited in the high risk individuals who are working on those industries, they can report to the safety officer. So what is involved in the preventive screening? As I was telling you, test the children at ages 1 and 2. So if they are found to be at high risk, they are to be tested annually till the age of 6. Then for the adults, there are some occupational health guidelines. So in adults, anything beyond 10 microgram per deciliter in the blood, and in children, in 5 microgram per deciliter in the blood is considered to be high blood levels. And in children, more than 10 microgram per deciliter is considered to be critical. And as I was telling you, in schools also, lead exposure risk questions can be conducted. The sessions can be conducted by the teachers, and this risk questionnaires can be filled by the students, or they can be helped by the parents to fill those risk questionnaires, or even we can utilize our own public health system, like our ASHA workers, our Anganwadi workers, to actually screen these children for lead toxicity. Now, what is involved in the physical examination? So we would like to do a comprehensive examination because lead is something which involves all the tissues in the body. It is deposited in a lot of tissues of the body. So a comprehensive examination which includes the neurologic examination, the hematologic examination, meaning analyzing the blood system, cardiovascular examination, as one of the highest risks of lead poisoning is increase in hypertension, increase in risk of ischemic heart disease, increase in risk of stroke. Gastrointestinal system has to be examined because a lot of children present with lead toxicity and their only symptoms are vomiting and constipation. Renal system has to be examined because it's a major cause of chronic renal failure. There are acute symptoms also, but one of the major effects is the chronic renal failure. In children, hearing and nutritional status is to be examined. Neurological examination in children has to be extensive because we have to see the cognitive and behavioral components also. As children, we have discussed that children with lead poisoning, they become irritable, they have a decrease in IQ, they exhibit aggressive behavior. So this is one of the common symptoms that are seen in children, and it is hard to identify as these signs and symptoms do not specifically sometimes point to lead toxicity. Hence, the screening in this case becomes very, very important. So what are the signs and symptoms of low toxicity? The patient can, or the individual or the child can present with myalgia. Myalgia meaning the patient will have complain of pain, burning sensation in the arms. Then there will be mothers coming to us who will say they are having symptoms of mild fatigue. So in this case, what happens is that generally a history of anemia is taken. So in some cases the patients turn out to be anemic also. So what is difficult is that if it is a mother or if it is a pregnant woman who is coming to us and is anemic, it's very difficult to distinguish whether it is anemia is due to iron deficiency anemia or it is due to a lead toxicity anemia, because both the features of the anemia are microcytic picture of anemia. And lead is one of the metals which causes anemia because it affects two enzymes, aldehyde and ferrochelatase, and it can lead to a picture which is similar to the iron deficiency anemia. So it is very, very important we do a capacity building in our institutions which are capable of detecting the lead levels in individual. Then one of the most common symptoms specifically seen in children is irritability. The child will have try to exhibit a aggressive behavior, will be irritable. Specifically, these can be identified in persons who are dealing with the children, their Anganwadi workers, the teachers in the school. But these are generalized symptoms. So for the teachers to identify, it is important that the specific questions are asked to the children. That is the risk question for lead toxicity. It is very, very important because irritability can be due to a lot of other reasons also. Child can be lethargic. A lethargic child, there are a lot of differential diagnosis for a lethargic child. So hence, I am reiterating that screening for lead levels in children becomes very, very important. And then the child can come with, this is a very common symptoms that we see in our clinical practice also, abdominal discomfort, and it will not be consistent, it will happen occasionally. So it's very difficult to pinpoint the diagnosis with a low level of exposure. And as I said, you cannot have a threshold for lead exposure. You can be exposed to lead from a very young age, and then you can exhibit the symptoms later in your life as an adult. So this lead accumulates in the tissue and there is endogenous exposure, and then you keep on accumulating the lead throughout your life, and it can lead to problems in an adult life. So it is absolutely important to remove the lead from the environment that you are living in, and it cannot be absolutely removed from the environment, but it has to be within the permissible limits. Then as we talked about the low toxicity, but then some people who are working in industries which are lead-based industries, or very commonly lead is used in paint, and if you are removing the paint, remodeling your house, it can be included, it can come in the environment or the air as lead dust, and children can inhale it, mothers can inhale it, family members can inhale it, or occupational workers who are coming back home with lead exposure, they can expose their families. So these people get a moderate dose of lead in their environment, and this can lead to moderate toxicity signs and symptoms, which can be, again, general fatigue can be one of the symptoms, difficulty in concentrating. Specifically, this is a very common symptoms in children. They come with this problem of difficult to concentrate in their class. There is the teacher may identify this, that the child is not able to catch up with his peers in his class. He has difficulty in catching up with the studies. So this is a very common symptoms of lead toxicity, and you can actually identify those children. They will be near an area which is high occupational exposure to lead. The mother was exposed to it, or even the mother is probably working in that industry, and during her pregnancy this lead was passed on to the child through the placental barrier. So this can be some of the challenging signs and symptoms that we see in the children, and to identify them and pinpoint them to lead toxicity is difficult. Then children or even adults can come with tremors. They can exhibit symptoms of headache. Gastrointestinal symptoms are very, very common. So they will come with a complaint of occasional diffused abdominal pain. There can be vomiting, there can be constipation, there can be weight loss. In some cases, there are patients who will come with all the signs and symptoms of anemia, and then we investigate them for anemia, and then incidentally we discovered that there is lead toxicity. So these are some of the signs and symptoms that people who are chronically exposed but to a moderate levels of lead that they exhibit. And what happens if you are constantly exposed to lead all your adult life? Then you develop severe lead toxicity. So this can be very, very harmful. It can lead to paralysis. It can lead to encephalopathy. That is, it will damage the brain, and it can lead to seizures, which can cause coma and even death. Gastrointestinal symptoms in severe lead toxicity is extremely profound. There is, as I was telling you, there can be intermittent severe abdominal cramps that can happen, and these patients can come to the hospital, but on examination, on an ultrasound or a physical examination, it cannot be identified what is the cause. So they might even get a misdiagnosis if there's a simple test of blood lead levels is not done. So it is important to screen for lead toxicity. It is important to check the patients once they are treated from the hospital. We have to review them periodically, whether in the environment the lead is reduced, whether their blood lead levels have come down. It is important to follow up with those patients. Then how do we screen for them? I was talking a lot about screening or identifying the lead content in an individual. So how do we do it? So we can do it by simply a simple blood sample. There are two different kinds of tests that can be done. One is the blood lead levels that can be done, and then there is the erythrocyte protoporphyrin levels. Erythrocyte protoporphyrin level is a very costly test and not easily available also, but and not extremely specific for this lead toxicity also, but blood lead levels can be easily done. There are point of care testing instruments that are available which can test for the blood lead levels. Then there is for confirmatory testing, then ICP-MS, which is a mass spectrometry test, which can also test for the lead content. It is very widely used and is a confirmatory testing for the lead levels that can also be done. Then there are radiological tests that we do in which we see the lead lines in the epiphysis of the bones. It's a simple X-ray that can be done and specifically very useful for the children. So a simple X-ray can be done, and a trained radiologist or a trained physician can identify the lead lines. Also on physical examination, these lead lines are also visible in the gingiva of the mouth. So this is a very common examination. On clinical examination, we can identify that this child or this adult has been exposed to lead. So these are some of the common tests that we do in our hospitals. Now, coming to the standards for lead, as Dr. Sushmitha was asking me earlier also. So the CDC recommends a level of 10 microgram per deciliter as a concern for children. The normal levels that are allowed is 5 microgram per deciliter, but if it crosses 10 microgram per deciliter, the child is at high risk. And what are the workplace? Because we are talking a lot about occupational health and the occupational exposure. So when do we decide that this person is at a high risk and we need to remove him from this environment? So at 50 microgram per deciliter for removal from the job and 40 microgram per deciliter for mandatory notification. You notify the individual and you tell him that he is at high risk, and if his blood level still keeps on increasing, then you have to remove him from that environment. You have to change the environment of the person. It is something like how we check for radiation exposure. Lead is as important as that. Lead exposure is as important as that because it can lead to a lot of damage to various tissues in the body. So it is important that agencies come up with regulatory guidelines. Western part of our world has done a lot for the regulation. We have our CPCB guidelines, we have our FSSAI guidelines. So we need to come up with these guidelines and have our individuals monitored regularly for their blood lead levels. So how do we clinically manage a patient once we have identified that this patient is suffering from lead toxicity, but we want to manage this patient? So how do we manage this? First of all, suppose you identify an individual at your industry, where usually industries have a medical officer also or a safety officer also. So that person should notify the referral center, which has been identified by the industry or the regulatory body over there. Then, as you know, this individual has had lead poisoning. Then environmental investigations have to be done. So you have to check the lead content in the soil, you have to check the lead content in the air, and it has to be within the permissible limits. If it is not, steps have to be taken to keep it in the permissible limits because other people are at risk at the same time. And you have to identify whether this individual got the lead poisoning from where he was working or any other sources are there, or it is a combination of sources that is giving him this high lead content. How can this happen? Individuals have to be taught about what is lead poisoning and how can they be exposed to lead. So education about the prevention is very, very important. Now, we have identified an individual. We get a patient who has come to us, has been referred to us by the safety officer that he has lead toxicity. How would we want to treat him? Is there any treatment available? Yes, there are treatments available. There are chelation therapies which are available. Calcium disodium edetate is one of the major chelating therapy that is given, which is given intravenously, which we use very often. And penicillamine is also given orally, which is also a type of chelation therapy that we use. Then chelation therapy is a very advanced form of treatment that we use for the patients. So this has to be done in referral centers which are equipped for the chelation therapy, and this is to be done by medical practitioners who are trained in this. So this is very, very important. And from a regulatory point of view, since we are in a lead crisis in our part of the world, these treatment options should be cheap, and they should maintain the quality, and they should be cheap, and they should be easily available. We need more trained personnel, trained healthcare workers who can give this chelation therapy. Then in this we have summed up what are the signs and symptoms, how we can test for lead, and if we identify an individual with lead toxicity, how can we treat them. But how can we prevent it? If we prevent it, we stop the disease at before it has even occurred. So how do we take the preventive measures? So first is reduce the sources of lead exposure. So as gasoline is a very very good example, it has been there has been lot of effort to remove it or decrease the use of gasoline. So it has reduced the lead exposure. Then you can replace the lead pipes and fixtures. You can use different material to use it. As I told you in the beginning, that lead is very less corrosive. That was the main reason why it was used in pipes and fixtures, specifically for drinking water, and it was contaminating the drinking water for a long time. But there has been a progression in our metallurgy also. So there are many other metals now which are also resistant to corrosion. So this lead pipes and fixtures can be replaced with them. Then it is very important to have a good nutritional diet with a high calcium and iron content. It is very, very important, specifically in children and in mothers, pregnant mothers. It is important that you have a diet which is rich in calcium and iron. Then you have to continue monitoring the blood levels. Screening is important in children, in pregnant mothers, even adults who are at high risk and have been identified as vulnerable population for lead exposure. Screening is very, very important. If they're screened and identified with high blood lead levels, they should be sent to the referral centers, and their blood lead levels have to be monitored regularly. Then it is important in industries which are dealing with lead to identify a safety officer. A person can be trained on lead toxicity or other environmental pollutants and has to be designated as safety officer, because that person will be referring the individuals to the healthcare professionals and help identify. Otherwise, it will be difficult to even identify patients who are coming with low toxicity or moderate toxicity. So how can we develop awareness on lead toxicity? So the major thing that we can do as even individuals is community outreach. We can reach out to schools. They can train the teachers on lead questionnaires, lead surveys. Even if the children are not able to fill the answers, their teachers can observe those children and can report to the school safety officer or the healthcare professional in that area and reach out to them and may identify that, okay, I have identified this individual as in a probable risk of lead toxicity. Would you want to screen this individual? So a communication line between the schools who are directly dealing with the children is very, very important. Then how can we reach out to the individuals, empowering the communities, reaching out to our, through the Gram Panchayats and the Anganwadi workers or the Asha workers. We can reach out to the communities. Then we can create awareness. We can run education campaigns on the effects of lead toxicity and how much lead is there in our environment or in the soil or in the food or in the cosmetics or traditional medicine that we are using. So this awareness is very, very important. So we have to envision a lead-free future, and to do that, what is important is ongoing educational activities. Everybody from all levels of healthcare, all levels of industries, our policy makers, all efforts of all are needed for a lead-free future. Lead has to be designated first as a major hazard and a health risk crisis in our part of the world. Then communities and governments and individuals have to come together and envision a future which is lead free for the children and the mothers, specifically because they are our most highly vulnerable population who are getting exposed to lead.
Thank you, Dr. Saswati, for such a wonderful lecture on the lead poisoning, lead toxicity, part 2. And this was really very beneficial for our learners and also for all of us. So in the beginning, my dear learners, our expert explained the symptoms and the toxicity of lead poisoning on the various organs and also various screening mechanisms that could be adopted in the health organizations and the health institutes. And as Madam said, that the screening is very much essential because sometimes it may result in the misdiagnosis of a specific disease, and this could be due to elevated levels of certain metals or any other compound in the human body. So thereby the blood lead levels are to be screened for, and then this may give clues as to how we need to prevent the exposure from the lead. Thereby we also touched upon the preventive measures that could be taken and all the ways how we can combat the effect of the lead in the environment and how we can use alternatives. For example, the older lead pipes, this could be replaced with the new technology which does not contain the lead-free pipe, or which contains the lead-free pipes or the lead-free paint and so on. So there have been laws, like even in the year 2022, the Ministry of Environment, Forest and Climate Change, they came up with the battery acid, that is a battery waste management rules. And so here emphasis has been put that even in the informal recycling sectors also, the battery and the lead acid batteries also should be disposed of in a very scientific manner and technique. And more, if the rules are stringent and the policy implementation is also done very well along with public participation, then we can effectively control the toxic elements and the hazardous elements being introduced into the environment, and also the health of the human beings also being affected. Thank you, ma'am, for the lecture, and I thank our learners for your patient listening. Thank you.
Thank you.